Hey nurses, welcome back to Howdy Nurse, your go-to channel for practical no-nonsense nursing education. Today we are talking about something called emergency drugs. Let's break it down simply so you can stay sharp and respond fast. Emergency drugs in healthcare. Understanding the critical role of emergency medications in acute care. It plays a vital role in acute care, stabilization of patients, prevention of deterioration, facilitation of interventions. Vital role in acute care. Emergency drugs are essential for managing critical situations like cardiac arrest and respiratory distress, ensuring patient safety and effective treatment. Stabilization of patients. These drugs aim to stabilize patients during severe medical emergencies, preventing further complications and ensuring better outcomes. Prevention of deterioration. By administering emergency drugs promptly, healthcare providers can prevent a patient's condition from worsening, facilitating recovery. Facilitation of interventions. Emergency drugs not only manage immediate crisis but also prepare patients for further medical interventions, enhancing overall care. Overview of emergency drugs. To do, in progress, and done. To do. Review cardiac drugs. Examine the use of epinephrine and atropine in emergencies. Study respiratory drugs. Focus on the role of albuterol and Atrovent. In progress, research neurological drugs. Investigate diazepam and naloxone for neurological emergencies. Task 2. Each task is shown on a card with title, description, team member, due date, and priority. Done. Compile antihistamine data. Summarize the usage of diphenhydramine in emergency situations. Task 2. Each task is shown on card with title, description, team member, due date, and priority. Emergency drug mechanisms explained. Now let's understand the action of key emergency medications. Epinephrine action. It stimulates alpha and beta adrenergic receptors, increasing heart rate and blood pressure to counteract shock. Naloxone function. Competitively block opioid receptors, effectively reversing the effects of opioid overdose and restoring normal respiratory function. Albuterol use. Activates beta 2 receptors in the lungs, leading to bronchodilation and improved airflow for patients with asthma or COPD. Emergency drug administration guidelines. Understanding doses and methods for emergency drugs. Epinephrine dosage guidelines. Administer 1 mg IV or IO every 3 to 5 minutes during cardiac arrest to enhance heart rhythm and circulation. Albuterol dosage instructions. Use 2.5 mg via nebulizer every 20 minutes for up to 3 doses to treat bronchospasm effectively. Naloxone administration protocol. Administer 0.4 to 2 mg IV, IM or subcutaneous. Repeat every 2 to 3 minutes as needed to reverse opioid overdose. Patient condition verification. Always verify the patient's condition before administering any emergency drugs to ensure safety and effectiveness. Indications for emergency drugs. Understanding when to use critical medications in emergency. Cardiac arrest treatment, overdose management, severe asthma attack relief, anaphylaxis response. Cardiac arrest treatment. In cases of cardiac arrest, immediate intervention with epinephrine and atropine can be life-saving. Overdose management. In instances of overdose, naloxone acts as an antidote to counteract the effects of opioids. Severe asthma attack relief. During a severe asthma attack, administering albuterol can open airways and improve breathing. Anaphylaxis response. For anaphylaxis, the immediate use of epinephrine is critical to reverse severe allergic reactions. Side effects of emergency drugs. Understanding some of the common side effects of emergency medication. 3 side effects. Multiple effects. Emergency drugs can lead to varied side effects that require monitoring. 2 drug listed. Key drugs. Only the 3 main emergency drugs are commonly referenced for their side effects. Withdrawal symptoms. Opioid impact. Naloxone can induce withdrawal symptoms in patients dependent on opioids. Cardiac arrest resuscitation. A teenager was treated with naloxone after an opioid overdose, highlighting the importance of timely intervention with emergency protocols. Emergency preparedness for educators. Essential practices for educators to ensure student safety in emergencies. Understand emergency drug protocols. Familiarizing yourself with emergency drug protocols is crucial to provide timely assistance during crisis. Stock first aid kits appropriately. Ensure that the first aid kits are stocked with essential emergency drugs and address various healthcare situations. Conduct regular training on administering emergency drugs empower educators to respond effectively in emergencies. Remember, you are the patient's first line of defense. Thanks for watching. If you found this helpful, like, subscribe and hit the bell so you never miss a Howdy Nurse update. Drop your questions or experiences in the comments. We would love to hear from you.